Thanks very much, David. So my charge is to do a 10-minute snapshot of what my lab is passionate about. And so we have 4 areas that we're delving into. The first is healthy aging. So I was really glad and gratified to hear some of the comments in the room about that area. We're very interested, as I had mentioned in my introduction, about borderless health promotion, solutions that really transcend education, language, and locale. Community-engaged citizen science, which I'm going to be talking a bit about in my talk, and reducing health disparities, which really is, I think, the most important global issue that we're facing. So we all know, obviously, that technology has been a major driver for a lot of positive things that happen in our country and in society in general. But we also know, here I'm speaking to the converted, that we've really engineered movement out of our lives, out of our daily lives in particular. And so the goal for our lab has really been, how can we harness technology for good in the health promotion area in particular? So we know that wearable and other IT companies are interested in motivating healthy behavior. We've heard that in the introductions. So we're going to introduce you to some of the things that our group is doing in terms of how we can really do this effectively. So what I'm going to be focusing on just a bit is 2 IT domains, the me domain and the we domain. So in the me domain, I'm going to provide a few examples of what we've been doing in telehealth, virtual advisors, and smartphone app platforms. So in telehealth, one of our major questions has really been about, can automated systems actually replace humans in terms of promoting regular physical activity? And to do that, we're using interactive voice response systems, which everybody in the room, I'm sure, is familiar with. I love the United automated response system. I'm sort of like this with the United guy. I'm talking with him all the time. He knows me, he understands me, and he's very helpful. So our group did the first study to actually pit humans versus interactive voice response systems in trying to promote regular physical activity in inactive midlife and older adults. And what we found, as you can see in red, that the automated phone advice, actually there was no difference in terms of how well they did relative to the human phone advisor. So my staff hate these kinds of slides because they're worried about their job stability. They're on the human side of things. But in fact, even though people didn't feel like they could actually change behavior with an automated advisor, they really felt like they needed a human. In fact, that was not true when you looked at their behavior. And now we're scaling this kind of technology up. So we have a national trial of over 24,000 older women involved in the Women's Health Initiative who will be receiving this kind of light touch to see if we can increase their regular physical activity and decrease their incidence of cardiovascular disease. Another side to this whole area has to do with personalized technology, and I mentioned this prevention of widening of the health disparities gap because of things like language barriers, reading issues, poor computer access, and low health literacy. And so we have been working with a team in Northeastern University to develop some very simple interfaces that anybody, regardless of education or culture, could use that provides both verbal and nonverbal communication. So I'd like to introduce you to our virtual advisor. This is Carmen. She's culturally adapted, she's bilingual, and you just interact with her with a touchscreen interface. There's no mouse, there's no keyboard, and she can sit anywhere. And she speaks 2 languages, as I said. And we have found in early trials that actually Carmen does incredibly well in using behavioral strategies that we know work across interfaces and being able to actually increase walking per week. And we actually targeted one of the more difficult populations in terms of their inactivity and the fact that they never get touched by scientists. And these are Latino, low-income Latino older adults who had very low computer literacy. Most of them had never touched a computer before. And so Carmen did a great job with them, and in fact, the participants grew very fond of Carmen. And even though Carmen speaks with a sort of a tech voice, so she doesn't speak with a human voice, didn't seem to matter. They found that they said that Carmen really cared about them. They felt close to Carmen. They trusted Carmen. They were interested in continuing to work with Carmen, and in fact, at the end of the research, we left Carmen in the community centers where they were going to interact with her, and they kept on interacting with her even though the study was over for another 5 months. So currently, we have an NIH grant, and we're pitting Carmen again against human advisors, well-trained human advisors, in a longer-term clinical trial in a number of community centers throughout the Bay Area. So if there's anybody out there that's into programming embodied conversational agents, please let's have a conversation during the break. We also have been working in the smartphone app space, and in particular trying to bring the decades of behavioral science to this field, given that there's millions of apps out there, but very few of them actually take advantage of what we know in the behavioral science field about how do you motivate people and keep them motivated over time. So these are our 3 walking more and sitting less apps. They use different motivational frames because we know there's no one-size-fits-all motivational frame for everybody. So we have an analytic app, an affect play app, and a social app. And in fact, we found in early studies that all 3 apps actually did end up increasing daily walking in our, again, this very inactive middle-aged and older population. When we actually ran experiments using the smartphone's built-in accelerometer, we found overall, interestingly, the social app that uses social avatars to show you in real time what you and your team members that you're assigned to are doing versus what another virtual team is doing in real time. I think what's more important, though, is that there was a lot of variability in response for the other 2 apps, meaning that some people did great with the analytic and affect apps, and other people did more poorly with those apps overall. So the question's not which app's best. The question really is about which app for whom. We also found the social app did quite well in lowering daily sedentary time, and also both the social and the affect app, both of these use avatars to really give you just-in-time feedback about how you're doing to reflect your activity levels throughout the day, and both of them did quite well in terms of reducing sitting time. So we would love to work with tech group out there on thinking about these motivational frames and really taking them to the next level. Going up a level, I want to just touch base about the we domain, and what I'm talking about in the we domain today really has to do with empowering what we call citizen scientists to assess and advocate for healthier and more walkable neighborhoods and communities, because it's not just about the person, right? We can motivate the person, incredibly well, but if they are in an environmental context that makes it very difficult to move and walk, we're really fighting an uphill battle. Public health has realized that we really need to work at both ends of this domain, up on the higher environmental end as well as in the individual end, and that's what we're trying to harness some technology to do. And so I can't stress enough the importance of local contexts and environments to regular physical activity. We've developed a very, very simple tool and app called the Healthy Neighborhood Discovery Tool. It's a tablet-based app that residents can use to assess their own neighborhood features that help or hinder active living. We've developed it and tested it initially with very ethnically diverse adults and older adults. When we did this on purpose, because we figured if those groups could use this app successfully, anybody could. The tool collects neighborhood info via GPS route tracking and geocoded photos and audio narratives, and it can be used to really educate residents themselves and physicians and other groups, but also local decision makers, and help to facilitate solutions around how can we make our neighborhoods more walkable. So we started initially in East Palo Alto. For those of you who are out of town, it used to be known in the 80s as the murder capital of the U.S. It's a very diverse, low-income community right next to Palo Alto. And we trained older adults who were able to use this tool to identify neighborhood barriers to physical activity and food access and advocate for change. And as they went through this process and talked to their local decision makers using these very simple photos and stories about what was going on in their neighborhood, actually East Palo Alto ponied up about $400,000 toward community infrastructure investments, things like repairing the sidewalks, planting shade trees, the kinds of things that older adults need to be able to do the walking that hopefully all of our devices are trying to help them to do. So we have recently gotten a Robert Wood Johnson planning grant to build out a global network of community-engaged citizen science for healthy living. So for any of you out there who are very interested in mapping spaces and integration spaces, I would love to have a conversation with you about how we can really build this kind of app out. So just quickly, some things to think about in terms of the future. We know that we're moving towards a population of older, more ethnically diverse individuals. Most will have smartphones and similar devices, so I think we need to start building solutions with those groups in mind. We need to program, as everybody in the room knows, for continuing engagement. One way to do that is to surprise people. We need to provide them with new insights that they're not getting from the devices they currently have, and to really bring value to their day. Embracing individual differences and insights is key. We need, I think, a little less of people like you sorts of feedback and more of, did you know that you, David, do this or do that? This really individualization. Obviously, systems that learn you over time, I think we can all agree, are going to have the advantage in this space. I think we need to utilize our residents and users more as partners in shaping the solutions instead of just pushing things out to people and watching to see what happens. We need to engage our users more from the front end. This is one of my favorites. For many people, elegant simplicity wins the day. For me personally, I'll buy an app because it's simple and easy to use and does what I want it to do. And then the programmers will push out upgrades that get it more and more and more complicated, and then I stop using it. And I'm not alone in that issue. Also, not everything is about social networks. Is there an app out there that doesn't try to push you towards a social network these days? So I think we have to really think about that. And I just want to also make a pitch about this 24-hour day measurement issue. We have two experts in the room here, Mary and Bill, who I think have done some of the best research to date. They have a great Medicine, Science, and Sport and Exercise article that reviewed all of your devices. So if you haven't seen that article and you're one of the 7 or 8 companies sitting in the room, you got to take a look at that article, because each device did well in a certain part of the 24-hour day, but really no device did well across the entire 24-hour day. So I'm going to stop there. Thanks very much.